It's a huge responsibility for me. Okay, so uh, Sripriya, do we have a case presentation today, or it's just the
Uh,
session and question answer?
just the session and Q&A we'll take
Oh,
up.
okay. Thank you. So thank you everyone for joining me today, and it's a pleasure. I always love talking to people who would who are interested in understanding what palliative care is, because I come as one of the beneficiaries of palliative care whose life changed completely because of palliative care. So thank you so much for being here this afternoon. So I'll just start with, I have a PPT, but we will go to that a bit later. I'll start with my story first. So why do I talk about caring for people with disabilities? I think being one and being cared for on a 24/7 basis is what uh, is the qualification for talking this to you now today. Because other than that, I don't have any medical background. All I have is like my experience with the medical system. So I met with an accident in 2010. So I was working as a software engineer in Chennai at that time. So I come from a rural village of Kerala. It is in the Kannur, which is north of Kerala, and a very rural village wherein I proudly tell everybody that we got our electricity connection to the whole village when I completed my 10th standard. So till 10th standard, I studied with this kerosene lamps, and then that too, which we get through the ration shop. So it is like limited quantity, and you cannot study all through the night for your exams, even if you want to. So that is how it was. So I did most of my homework during the uh, interval time in the school, because back home I'll not have any light and electricity or any like enough kerosene to light the lamp. So those were the times, and those are the places I come from, and I say that proudly to everyone, because I take like being there in that kind of a village and studying, and then coming out and like being a software engineer in a city like Chennai and all were so like proud thing for me. So that is what I was, and I worked there for 4 years in Chennai. So it's like, okay, Monday to Friday it is all work, and then Saturdays and Sundays to the beaches. And I love reading and I love walking. So I'm like wandering around through the beaches, going to the library, finding books. So that is how life was. And then like I came home for a holidays, and while going back, I met with an accident. I was standing on the doors of the train, and then I was thrown out when the door got closed accidentally. So I woke up in a hospital 2 days back, and what I remember was like I couldn't move any of my limbs, and then I had a fracture here, so my hand was actually on the sling, and I had a very heavy collar on my neck. So I had actually like fractured 2 vertebrae and then injured my spinal cord. I didn't know that. And my biology was very bad, that I decided from the 10th standard that I'm not going to study biology at all anymore. And that time we had an option to choose this maths alone, maths, physics, chemistry, and without biology. So I was very happy to do that and then get rid of biology. So my biology was very like limited to understand what your spinal cord does for you. So I learned it through experience. I did not know. I did not have any sensation, and then I did not have control over my bladder and bowel, and I did not have the temperature control wasn't there in my body. So it was all so much to go through, like to say the least. And then what happened in that hospital was like, you know what, the moment you get into a hospital and especially into an ICU, what you lose is your sense as a person. I was no longer Ashla. So the one who was so proud to be in a in a position and in a work and in a place, I was no longer that. I was a case of quadriplegia, and then people were talking about me and not to me anymore. It was like, okay, so what are her vitals and how is she doing? And then nobody is asking, how are you doing? Did you sleep well? That question is while you are in the ICU, that question is to your nurses, and while you are in the room, that question is your caregivers. So I would know whether I slept well or not better than my mom or my like nurses in the ICU, but then they did not want to hear me. So that is how it was. And what else was happening was like, okay, so during that acute time, everything was taken care of. It was like, okay, my spinal cord got like fixed. I went through a surgery. I was moved to my room, and my mom was caring for me. And then I went into another hospital for rehabilitation. And then I was in different hospitals for almost 4 years getting rehabilitation, because it was like, it was learning everything from the scratch. And I had to learn to move my limbs. Like even now I can't move beyond my wrist. And then so learning to write, learning to like feed myself with a spoon, and learning to sign, learning to use my computer. So it was all like new learning. So I was like, I had a very busy time there, doing physiotherapy from morning till evening. But the how do you say, the what was happening all through that time was like, what my symptoms were ignored so much, but my condition got all the care. It was like, okay, when I was in the ICU, my spinal cord got all the attention and it was fixed. And while I was in rehabilitation, okay, all my muscles got all the attention, and they were trying to make it work, make it strengthen and all those. But I, as Ashla, what do I want to do, or what I was going through, my constipation, my catheter blocks, and how do I change my catheter? What are the logistics for changing it? While I was in one of the hospitals, like I was staying in the guest house and getting physiotherapy in the OP physiotherapy department, because I could not be admitted in the IP wards. And then I had to pay the casualty charges to get this catheter changed. So it is like casualty charges and all the whatever medical supplies which were required, and the doctor. And finally, by the time I come out of the casualty, to just to change one catheter one time, that is once in a month process, and then that would have costed me around 2,000 rupees. And like that was like so much during those days, that okay, and just being in that hospital, being part of that hospital system, and still getting like smaller things like that, taking so much of effort and money. And then how do you reach from that? Was a very big tertiary hospital, and from my like guest room to reach till the casualty, it takes like long walk, very long walk. And then my mom and one of my other caregivers pushing my wheelchair or even stretcher. At that time, I wasn't well enough to sit in a wheelchair during those times. So those were the things which I was going through. And then it was, I somehow felt like, whereas I did not have so much of time to think about it, but I forgot who I was. That is what actually happened. I did not worry so much about my dignity or people dehumanizing me or anything during that time, because I was so busy with coming out of whatever I was going through. But in during that time, what happened to me was like, I forgot who Ashla was. And then it was like almost 4 years in different hospitals. Luckily, my mom had so much of money. You know what happens in our villages like that? They save all the money for your marriage. They don't spend it on girl child's education so much. So my mother was I lost my dad when I was 8 years. So, my mother was very clear that you get into any college in the merit seat, we'll pay the college fees and like let you study, but I'll not pay any fees for like any money for your seat. So she was very clear on that from those school days itself. So only thing I could do was to study hard, because when my father died, what happened was like we were two like girls. I have an elder sister. So we were like, okay, everybody was questioning, like, what are you going to do with two girls? Uh, like my mother was a very young widow, like she was, I think, 34, and my father was 43 when he passed away. And everybody was asking that question. So I somehow wanted to prove that, okay, so uh, girls can do something. And then people also told me very clearly that now it is your responsibility to do something. Like you have to study hard and you have to get a job to support your mom. So these were there in my mind. So only thing I knew was to study hard. So I did that and I got into college, and then I got into that job also. So mom had actually saved some money for my marriage. So there is no other way. So she spent everything for my treatment at that time. So that is what happened. She had some money that kept us in different hospitals for almost 4 years. And the reason which I could not go back home was like there was no physiotherapy was not heard of in those places even during that time. And I did not have any road access to my house at that time. It was like, okay, so some 200 meters like pathway. And if I fall sick, if I had a fever, it would mean that, okay, two people will have to carry me in a chair for 200 meters, get me to a road, and then from there in an ambulance to a hospital, which is 5-6 kilometers away from my house. So that meant so much, and without any physiotherapy. And doctors said that physiotherapy is the only way go forward for me. So mom did not want to go back, take me back home in that situation. So we happily stayed in different hospitals getting physiotherapy. So by 4 years, mom was like, okay, we have finished almost all the money, and then now we'll have to think about going back home. And then I did not want to go back home, because by then I had rejoined my job as a work from hospital like option. That wasn't like work from home was not this popular at that time. It was all pre-COVID in 2010, 2011 and all. But then my company was so considerative, and then they said that, okay, fine, if you can work from hospital, please do that. So I restarted my work part-time. So going back home would mean that, okay, I don't have any mobile coverage. I don't have any proper internet facility available. And then even though electricity was there, it was like there is a rain coming and then the electricity goes and God knows when it is going to come back. It is like, okay, you will have to call your electricity department, but they'll ask you to wait. And that is what we used to do, wait until it comes. So that would mean that I'll not be able to do that part-time job also. And then life would have been hell. So I didn't want to go back home. So it was at that time that I started searching for a place. I was just thinking, what can I do? So by then, I could sit in a wheelchair like this and talk to people, and I could listen to people, and then maybe I could use my laptop so I can do whatever this laptop lets me do. And so I was just thinking, okay, these are the things which I can do, and where can I go? So then I thought, okay, maybe I can go to an old age care home wherein there are people. That was my basic criteria. There should be people to care for me also, because I need a lot of help. still I need help to like get a bath, get dressed, and it is like I need two people to shift me from bed to wheelchair to be here and sitting here and talking to you. And it is all my mom's work to dress me up like this. So I needed a lot of care. So where there is a caregivers available by default and where I can contribute something. So old age care homes where one of the options came to my mind. So I was like, okay, maybe I can read to these elderly people who love books but can't read for whatever reason now. And I can listen to them when they must be lonely in places, so I can maybe sit and listen to them. Or I can go to some schools like this special children school care homes like that, so that maybe I can teach them basics of math and English, and then they maybe there will also be caregivers who can help me also. So those were the options which came to my mind, and I started searching. So, and some people helped me. It was like, it was a different mixture. Some people said, you're crazy, go. And then I tried telling this idea to my mom, and she thought I want to go to an orphanage. And I got calls from like my uncles, my brother-in-law, and everybody calling me from the next day asking, what did you think? You are not an orphan. You're not going to go to any orphanage. You are going to come back home. Okay, so I understood that I made a mistake. So I stopped it there, and from then on, I did not tell anything to my mom about my like trial and error of finding some place. So, but some friends said, yeah, maybe we can try. I don't know any place, any such place, but it's worth trying. So they were also trying to find some places, calling some places, visiting some places to understand whether it works or not. And then one of them found Pallium India, like as a like she has a this curious like I call it sometimes funny habit of reading this all newspapers also. She used to travel for work, and she'll be gone for 3-4 days, and then while coming back, she'll read newspaper from the oldest because she can't skip news. She loves reading newspapers, and she can always catch up on the TV, but then she has this crazy habit of reading. So that is how she found Pallium India in a 2 days all newspaper after coming back from a work travel. So it said something like, it was just 2 lines that, okay, Parliament, Social Justice Department of Kerala, Government of Kerala is starting a project with Pallium India for rehabilitation of people with spinal cord injuries. So then she thought, okay, maybe if Pallium India is doing that along with Social Justice Department, this organization should have some facility to care for people with spinal cord injuries. That much is obvious. So shall we contact? So that is how we found the number of Pallium India from the internet, and I called the IP and then spoke to them, and then said this much, right? Like, I'm a person with spinal cord injury, so I'm searching for some place, and they did not know how to answer it. So they said, we do that even now, that, okay, I'll give you the number of the chairman and email ID of the chairman. Could you please write to him? So that is the easiest thing for all of us to do. So yeah, like I got his email ID, and happily I wrote to him. It was Dr. Rajgopal at that time, and then I wrote to him saying that I am so and so, and this is my physical condition, and I would like to volunteer for Pallium India. And even if I can't do that, I would love to talk to you at some point of time, and I gave my number. So he called me back in another 2 hours. So he said he's attending a conference in Delhi. So if he doesn't come back to me in like after 3-4 days, please write to him again or call him again, because he tend to miss emails and correspondences while he's on the travel. So I understood that later, what that means. And then but he was very prompt. Next day morning, I got a call from one of our another trustees, Vinod Hariharan, who is incidentally our chairman now said, can I come and meet you? Where are you in Ernakulam? Can I come and meet you? So he came, he met me, and we were talking about, okay, what I was going through, what are my needs and all. And what happened was like, I wrote to Dr. Rajagopal on July 28th of 2014. And exactly 2 months later, September 28th of 2014, I was here in Pallium, India. So I left like Ernakulam and then I traveled all the way. I was almost dead by the time I reached here because I never did like a road travel during so long years. And then it was very difficult. But I reached here and I came as Dr. Rajagopal's executive assistant and also as a palliative care recipient. I got all the care from here and I started working as his assistant. That is how I I learned about palliative care. I only knew that okay, Pallium India is caring for is providing palliative care, but I did not know what exactly it was. But I was lucky enough to learn it from Dr. Ashopal directly, and that is also on the job. And then I heard him talking to people. I saw him uh, like seeing patients and how he was interacting. So I learned all those like from him. And that was the time actually I started looking back on my 4 years, which I spent in different hospitals. And I was like, I felt so angry sometimes that I was treated like this. My mother was treated like that. And something called palliative care was like known to people, available to people, but then nobody gave it to us. My mother, she has a chronic backache problem from her, I think 45 years. And then she was caring for me 24/7, and nobody even asked for her name for the last 4 years when she was in different hospitals. Only times I remember she was asked about her name and age was to write a prescription when she had vertigo and when she had fever. So during that time, that was also very mechanical that they don't even remember what it was. But then for the prescription, name, age. Okay, so that is written there. So that is how it was. And it was like, and when we came here and when we met Dr. Raj first, and then it was like, okay, he was asking her, what is your name? How old are you? And then do you have any health issues? And how is it to care for Ashla? And that was such a question for her, because one moment she was the proud mother of a daughter who was working somewhere and doing something. And the next moment she was like from that village taken to a different multi-speciality hospital, which is so big, where she doesn't even know how to navigate between. And then she was asked to care for Ashla. And what was she told? You should be very careful about her skin. If you get a wet sore, that is it. Her recovery is going to be very delayed. And then you have to be very careful about her collar, because if you do it, if you turn her differently, that is going to affect the fixation and the surgery. And you have to apply moisturizers like this. You have to turn her like this. You have to give a sponge bath for her like this. And she's not a nurse. She's just a village lady from there who is so used to caring for everybody else. Okay, cooking and providing, and then walking in in those greenery and caring for trees more than caring for sick people. And this poor lady is being scared so much that she doesn't get an opportunity to ask her doubts to people. Like, how do I do it? Or I did not understand it. And next day, when the doctors and nurses come for rounds, she's so scared to tell that she missed something. How can she even say that she did not understand what they explained? That is impossible, right? We're all healthcare providers, doctors and nurses and all the professionals, and then they are telling you something, and how don't you even understand? And how do you say that you did not understand? So that is how the situation was. And then I understood it, or I realized it only after coming to Pallium India. So okay, then that is how life is, and it is going to be almost like 10 years in Pallium India, and I am being so happily working with like Dr. Ash and then Vinod, who is the chairman now, and also with the patients, like especially with spinal cord injuries and other disabilities, so that I sit in a wheelchair, I move around in a wheelchair, so they connect with me more so that I can tell my stories, I can hear their stories, and all those things are happening now. I said I can listen, so I'm listening to so many patient stories now, and I feel so privileged and honored that people are sharing their lives with me when in their most vulnerable state of life. I know what is it to go through that, and I could never trust anybody enough to open myself and tell certain things. So now I can be in that position, being there, and then they trust me enough to tell me all those things, and I feel so privileged. And I talk to people, and I talk to professionals, and I talk to people like you also who would like want to understand what palliative care is and how you can contribute for palliative care, and even to the doctors and nurses who come here for training. And then I do rest of my work with my laptop. So I listed things which I could do, and then I'm doing most of it now. So I'm so happy about that. So that is why did I tell this story to you? So I just wanted to share my life with you to say that everything I'm going to tell you about disabilities and people with disabilities and caring for people with disabilities are not coming from my personal, my professional learnings. It is only from my personal journey and what I have learned through it, and then what I felt. And what I felt, which I don't want others to go through it, and what I received, which I would want everybody to receive it while they are going through it. So these are the only two kind of experiences which I got from other different hospitals and with palliative care aspects. I also received some palliative care, like, I don't know, maybe some droplets of palliative care here and there, like people, physiotherapists, when they were caring for me for a long time, we get to talk to each other, and then they ask me for my story, and then that is when I end up telling them, okay, I had a job, or I still have a job, I work. And then it was like, okay, so I was a software engineer. And then the whole, like, it is actually very interesting to see how their perceptions change when I say that I had a job, I was working as something. Because people are so used to see me as not just me, uh, like patients in wheelchairs and beds, and then they don't see beyond that they had a past, they have a personality, and they had their likes and dislikes also. They had dreams, they had relationships. Those are all forgotten because the only thing what matters is the disease. I had a spinal cord injury and they had to fix it. The neurosurgeon had to fix it, and nurses had to care for me until I get back to my room. So, and I had a disability, and then rehabilitation specialist, they had to give me physiotherapy and rehab. So that was the only thing which mattered in the healthcare space. I don't know whether we can call it healthcare itself. There was like how much of care was it there? I did not experience so much. So that is how the system was. So, and that is why I'm so happy to talk to you all, because you want to make a change in the healthcare, and I'm sure that after learning about palliative care, after understanding and practicing palliative care, you're going to change like lives of people. There were some lives in my life where people cared for me or treated me as a human, and then that changed my life so much. So you are going to be those kind of people for so many other people, and that is why this feels like a good time to spend with it. Okay, so that is my story. Do we go to the PPT and talk about disabilities and how do we, or what do we go through, or do you have any question or any comments to share, or any experience you have with people with disabilities to share anything? Maybe we can take some 5 minutes and do that if you have any, and then we can go to my PPT and talk about more serious things. Any quick comments or? Okay. We'll give you 1 minute to think of.
Thank you for your story. It's really very, very inspiring. And what was amazing is that through all this that you've gone through, you're still smiling. And it reminds me of a friend who had, she had childhood polio, which later it became scoliosis, and it was very tough for her. Can you hear me?
Yeah, I can hear you, but can you hold on for a moment? Can you switch the fan off? Yeah, tell me.
So I felt that, towards the end of, throughout her life, in spite of all that suffering, she always had the smile. And I think when, because of the way her ribs had got distorted, she couldn't breathe very well. So that became a problem. And when she was passing away, I think her family did all they could, but somehow she had also, how should I say, attuned them to the condition that, look, this, you have taken very good care of me. And, if it doesn't work, don't blame yourselves. And it was very, very beautiful the way, they looked after her, because she said, well, she told me once, I have to say something to you. In spite of all this, because we were in college together and I'd be very protective of her and in the buses if they didn't stop, like, wait for her. She'd say, look, I know you always felt that way, but because of my condition, and I couldn't believe she was saying that I actually visited so many countries abroad which have good wheelchair access, and I saw places of my dreams, which, if these countries didn't have that wheelchair access, I wouldn't have managed. And I feel that maybe that is also one thing that I often think about, that wheelchair access today is made in shops and they are so steep, you can't really use them. So I'm just thinking, it's a thought that came to me as I was speaking, that maybe even in the everyday, there's something for us to do that, measure it properly if it has to be useful. But thank you for your story.
Thank you so much. So I'll just share my PPT. Okay, so this is only for you to read. Definition. Okay, I'll give you 1 minute to read the definition and let me get somebody to reduce the AC. Ash, can you reduce this AC also for me a bit? It's so cold. To try whether you'll be able to. Well, otherwise, you can switch it off for some time and switch it on after some time. It is. Okay, so hope you all did. So these are the. I just put it here so that you see some kind of a definition. This is also, it is not the complete definition of from the WHO, but I just, it is a long definition, so I just put some keywords here. So we'll be talking about impairment, activity limitation, and participation restriction, etc. So my next slide is, okay, so impairment is that I have an impairment where I cannot use my legs. I cannot walk. Because of that, disability says that because of that, I have an. Okay, then. Because of that, I'm not able to participate in any of the activities which is happening. So that is my activity limitation. So how it becomes a disability is like I have an impairment and my impairment becomes a disability when I'm not able to participate in any of the activities actively in the society. And this is actually caused by the environment. Actually, how Indira said it now, ma'am, it is very correct. The physical environment is not accessible to me. So when that is not accessible to me and the attitude of people, it is like, okay, when I go out, why are you out? Or why can't you stay home? So those are those kind of attitudes. All these together are making me feel disabled. For example, I'm in Pallium, India. I stay in Pallium, India, and I work like my home is one room, and then the next room is my office. That is how it is designed now. So it is like, and this whole environment is accessible to me. So my wheelchair. So, and I have people like Sri Priya and other colleagues. So they are all colleagues to me, and we treat each other as colleagues and friends. So it is that environment is accessible, attitude of people are welcoming, and so I don't experience any disability. I have an electric wheelchair, and the moment people make me sit into this wheelchair, I can move around. I'm free in this like world, uh, not only physically but also socially, because people are like happy and welcoming. So I don't experience any disability, though I have this impairment. So that is where this society's role comes in very strongly, because these two, the environment and attitude, these two are actually dependent on the people who are living in the country. So we can make this environment accessible. We can build proper ramps, as you said. It is not, people don't understand why they are making ramps, and that is why they make those steep ramps in the ATMs with ramps in front of closed doors and all those kind of funny things which they do, because they don't understand why are they doing it. And attitude of people are also like that, that I've been asked once, like, okay, why don't you stay home? I was actually trying to cross the road, and then that lady was only scared that like the drivers, they do this rash driving and they're not going to see me and I'm going to get hurt. It was only that she was afraid of that, but the way she put it was like, that is the only thing she knew, like, why are you out here? Why don't you stay home? So that is how our reactions and responses and attitudes are coming out. So we can change that, and we can change that environment, and people like me who is having an impairment will not sense or have a disability in those kind of a place. So, and these are also, I took this from WHO list. There is a long list which you can go and find, which only says that there are like a lot of people with disabilities, and then it is increasing because of so much of so many reasons. Like there is a chronic health conditions, or we are like our life expectancy is more now, so people are going through a different health conditions, and there are other causes also. And then it also says, it is something interesting to me, it also says that everyone is likely to experience some kind of a disability, temporary or permanent, at some point in life, because we also say that in palliative care that okay, only like 90% of people like die, only 10% of people die a sudden death. All 90% of people will go through some kind of an illness through their last days of life, and so they experience some kind of a disability. And then when people with disabilities access healthcare, this is like you may not even imagine that these kind of things might be happening. The discrimination in terms of like how do you get into an X-ray machine, how difficult it is, and how you are helped to do that, and how people are handling you, how welcomed you are to such kind of a places. These are all like, I wouldn't want to be going to simply like going to a hospital and asking, okay, get me some kind of an X-ray when I need it. I would try to find out where I have people who can help, who is ready to help, some kind of connection, so that I know how I'll be treated when I go there. So in general, when somebody goes to a hospital, they are not welcomed very much when you have a disability. Even people with blindness, people with like deafness, how much of communication is happening between somebody who cannot speak, who uses a sign language, uh, between the doctor and the patient, very less. And then how blind people are being navigated through it. So there are like, when we talk about disability, it is all disabilities, and then there is a lot of discrimination people are going through when they try to access healthcare. And this WHO itself says that we need to include disability and scale up that kind of activities so that people get some kind of a care. And this is a study, like it's a all one, but still this is, even now it is applicable, that when a child is born with a disability, he or she is not getting enough education. Without enough education, he doesn't have a job or income. And then it is sure that he's going to experience some kind of a poverty. And then because of all these, there is a poverty, there is a lower education level, and then employment is not there, and higher medical expenditure. Also, so disability is associated with all these things now. Higher medical expenditure, I'll show you some things in this. Accessibility. So because of all these reasons, people are not reaching hospital on time, even when they have some issues. We have seen so many people, when they have a urinary infection, they know that it is a urinary infection, but then what they do is like, okay, let me drink. When they have a fever, they know because it is because of urinary infection. And then they, okay, let me drink more water. I don't want to go to hospital today. And then next day is like, okay, let me try something else. And next day is like, okay, now I need to really go to a hospital. So I need to find out somebody who can like help me with that. So we see, and by the time they reach here, or by the time we reach them, that infection must be like increased so much. We see those kind of situations a lot. So why people hesitate to come to hospitals or access healthcare when they have a disability is one thing is accessibility. Uh, uh, Accessibility. How do we reach a hospital? So as I said, like if I was in my home in my village, like how would I reach a hospital when I have a fever? So there are people accessibility limitations wherein I'm not able to access the door, like road easily, and then access the vehicle and then reach the hospital. That is there. And how many people do I need to help me to reach hospital? And then what is the high cost of transport? It is like when you have an issue, you can actually get the public transport, but then I'll have to find an ambulance or a car or something like that. So it is a high cost of transport and financial issues. You might also like already been going through a lot of financial issues, and then this is like high cost of uh, cost where you need to help, you need somebody else's help. And then what you need is like depend on somebody else. And then that means that if that person is going for a job and then it is a day of absence from job for that particular person. So these are like so many different factors which affects and which like prevents a person with disability to access healthcare. I'll tell you a very like a small example. What happens when you have a toothache? Okay, for one night you had a toothache and you could not sleep at all. Next day morning you get up, you get ready, and then you find the nearest possible like clinic, dental clinic, and then get it like addressed, right? And then what happens? I actually got like a toothache one night, and I was having this problem for some time, and I was like ignoring it. And like it's okay, it's okay. Not there is no time to go to hospital, or then I'll find it later, or I'll deal with it later. So it was like that for so many like weeks and months, and then finally at one night I couldn't sleep at all. So I was trying to like keep it like this. I couldn't sleep. So I actually literally stayed up all night. And then next day morning, you know what happened? We have a colleague. So I was calling her. She's a dental surgeon. So I called her, like Devi, I have this like toothache and I need some like go somewhere. What do I do? And so we had a dental unit here, but then like before, but then when we moved to this new place, we did not have a enough space to keep it. So that is all packed and kept. So we don't have it here now. So we'll have to go to another hospital. So she was like, you know how the dental clinics are like, mostly they are on the first or second floor of a building and then with narrow steps and all. So she was calling different hospitals and then her friends and colleagues from the field trying to find out which hospital has got a dental OP and where there is a lift and a ramp and all. So she found a place, and then we had a like a driver here and vehicle here for me to go there. So I could go there, and then I had people also here to help me with the like getting into that vehicle and getting out of that vehicle into the wheelchair and all. And then those people also knew that somebody like on a wheelchair is coming, so they were also prepared for that. So I had all these things, and then that was the only reason why I could actually extract that like tooth by end of the day, and I could like get it done. What if I would have been staying at my home with only my mom to care for? I don't know, it would have been a nightmare for me. So something which is very small and very like trivial for a person who can access all these things, who is able, it is not the case for a person with a disability. So It is, from that itself, I could understand it. And whenever I think of people in our care, I always imagine what I would have been in my village, because I know most of the places where we go and do home visits. I'm sure that you would have heard of the work which we do, and then home visits and all by this time. So I compare it with that. Those kind of the places are where we go and provide care. So this is maybe for us, when we are so able and when we are not in that world, these are the kind of things which we wouldn't even give a thought. So, but then for people who are going through it, it is a very difficult situation to go through, and finding a solution is many times very difficult. So these are the kind of barriers people with disabilities experience when they try to access healthcare. And this is, I just wanted to show some like terrain where our team go. I had never gone to that kind of a place, but these are some of the pictures I took. These are the kind of places where we reach people so that they get the care where they are. So, and this is also another question. What can palliative care do? So, because we have a lot to do, because we don't have so much of a primary health care available in our places, and also like rehabilitation for people with disabilities. As your friend said, when we go to an advanced developed country, there are people with like disabilities, then they are like they move around just like anybody else. They don't have to depend on people, and then they have a job, they work, they shop, they like manage their house, and those kind of things are happening. And then what happens is, like, when they acquire a disability, they go directly to a rehab center, and then they spend time there a year or 6 months or whatever is required. But then that is not happening here in a country like India, and because of that, there are our health related issues are so much. So palliative care should actually try to access these kind of people and then mitigate that kind of suffering. Only because of that, because I get repeated urinary infections because I don't have enough people in my home to actually take me to hospital like that time, or then health skin issues. We have seen so many people dying of secondary infections from the pressure source, because we don't have enough facilities there to shift from the chair to bed, or then care for, do a proper skin care and all. So this is something which actually Kerala has been doing for many years, because we have included people with disabilities, and there are so many NGOs working, especially in this domain. So it is like, that is a proud thing for Kerala, but it can happen in any place in the country also. And then people anywhere need these kind of services to be available at their houses, wherever it is. So this is something like I just put some pointers wherein we can like think of and discuss. So this is like something which I think of, because when I include myself and my mom into the society, if I'm independent and I can live independently in this society, and my mother is free, and then she can also contribute something towards the society, and I can also contribute. So only when we are all healthy and we are all able to contribute, that is when the country is going to grow higher. So it is like the total, wherever we are living in this society, the health of that society is the total health of everybody, and that includes me also. If I'm part of that society, that includes my health also. So if we understand that, what we can do is, like, as palliative care providers, we can sensitize ourselves to specific issues and challenges. Why am I not getting into hospital? Why am I hesitating for that? What are the extra help which I require, so that I stay in a hospital and get the treatment which they need? And one more thing is like it is disability. I cannot walk. That doesn't mean that I cannot think or I cannot talk. That is what is happening many times, that when you see somebody on a wheelchair or when you see somebody cannot see or somebody cannot speak, we associate that with decision making. We say that, okay, so that person cannot take any decision for themselves. But we are all, we have, I have my own wishes and I have my own opinion on things. And all the more I know what I want in my life, at least. So respect that. And when you talk to those kind of people, then it takes some extra time to understand what it is. I may need like help to understand that. As I said, I don't study biology and I'm not a healthcare professional, so I don't understand so many of the things you talk in the healthcare field. But what I understand is like, okay, so even when I have an indwelling catheter, I don't know the risk of it. When people compel me, when my doctor, my urologist compel me to change to an indwelling catheter, I don't know what is the difference first. But all I know is like, it is very difficult for me. Then I need you as a healthcare professional to sit with me and say that, see, these are the health issues which you may end up with having in the near future uh, if you have a prolonged indwelling catheter into it. So they tell me that, okay, there are risk of repeated infections, there are risk of kidney stones, there are risk more like higher risk of cancer or whatever it is. And then I understand that, okay, so that is what is involved in an indwelling catheter. And what is involved in an ICC, it is like I'm dependent on too many people to get it done. I can't do it on my own. And so that means that my quality of life is reduced on a daily basis. So then I decide that, okay, so I understand, okay, so it is, uh, there are future risk there. I understand that, but then what I need is today's quality of life. I want to be free with a indwelling catheter and a bag. I'm doing that. So there might be some people like that, or there might be different opinions for other people also. They may decide that it's okay even if I did depend on somebody for this. I want to do ICC. That is different people have got different decisions and opinions. So it is okay, but we need information and we need your help to come up to a decision. But then it is not that, okay, you assume for me that, okay, I need this and you do this for me, but asking and sharing and then helping me to take a decision is actually very important. And then this is something which we already saw that, okay, at some point of time, everyone are going to experience disability. But I'm not saying this because of that. I'm not saying that, okay, so you are going to experience it in your life at some point of time. So include me into your society now. I'm not saying that. I'm saying this because I, as a person, and I as a disabled person, and you all as in like able-bodied people. But then while we are in this room, in this Zoom room for 1.5 hours, we are a society, we are a community. So let's be together. It's not like you being in one part of the world and me being in another part of the world, and I'm telling you what it is, or you are telling me what it is. Let's be together and let's be us for this time when we spend this time together. And I believe that is important, that is applicable to any society or any community. So that is the only reason I'm telling this. And I don't want anybody to think that, oh, I'm going to experience it at some point of time in my life. So let me be compassionate and sympathetic to people with disabilities now, so that I also will be treated like that before. Please don't get into that kind of situation, but then please let us be together because we all are part of single society. So I have a video. Uh, I'm just trying to play this and I hope it comes up. Sripriya, just tell me if you're not able to hear this, okay?
Sure. Music is not there, Ashla.
Okay, one second, 1 second. So I should share it with sound.
Yes.
Better now?
Yes, it's audible.
Huh.
Morning, Alice. Morning. Awkward no more. Nice job, Bob. Go forth and be human.
Okay, so I hope you all enjoyed the video. So now it's time to tell me, what are the some keywords we heard here?
Treat disabled people the way we ourselves want to be treated by others.
Okay,
Respect is a big word that kept appearing many times.
okay. Other words? Whatever you could remember.
Ask for permission.
Yes. Personal, right? There are things which are personal. There are decisions which we can take. Okay, so there are so many like videos like this, like in the Google if you go. But I just wanted to show you one so that you get a sense of what are the kind of things available like over there. So in this is not in any way we are going to talk about disability etiquettes. We are going to touch it, but it is not any way an exhaustive list. You can do so much. You can teach yourself. But my only thing is like my only agenda here in this day and in this talk is like get you hooked to this so that you go and Google about it so that you understand like more about it, and then maybe next time you talk to a friend, you talk something about this to that person so that like they also learn about it. That is the only way which we can learn. So because when I say all these things, I don't find fault on doctors when I said I was mistreated in hospitals many times, because doctors are not, healthcare professionals are not taught about palliative care or not taught about communication. And we cannot expect magic and miracles by the time they come out of the hospital. The moment they get their degree, they become all compassionate and all professionals in communications. They do what they are taught. And they've been seeing that from the day, like maybe the year 2 or year 3 in the hospitals, how their seniors are treating. It is not taught in their curriculum, and then by what magic are we expecting them to be all perfect when you do that? The same way, we are taught like when we are like 3 years or 4 years, like, okay, this is how you eat in a dining table, and this is how you give things to people. This is how you say sorry to people, and this is how you say thank you to people. And then we have never told those kids how do we like interact with a person with disability. They would actually do it very well if adults are not there. But then we are so awkward, like we don't know how to deal with those kind of situations as adult, and we make it like sound and seem like so big thing, and then they don't know how to deal with that. Then how are we expecting those kids to like grow up and do things which the way we expect them to do? So these are not our faults at like any way, because I was also till my 28 years, while I was walking and running and doing things, I was never sensitive enough to any of these needs. So I don't find fault on any of those people who are actually doing this to me without knowing that. So all I can do is like to talk to people whenever there are like possible opportunities, so that people get more awareness on this, and then they get interested and they change. So that is the only aim for this video and some of the slides coming up. So next is. Okay, so the first is like, do not assume that everyone needs assistance. Of course, we may need. I know I've been living using a wheelchair for the last 13, 14 years. So I know what do I need like on a daily basis. So what happens is like, okay, so I don't need help to operate my wheelchair. I don't need help to operate my laptop, but I need help to open the door or switch on the fan or switch off the AC. Those are kind of things. So before, and you know how many times people started like pushing my wheelchair to help me. My wheelchair is around 44, 45 kg, and I must be 60, 65 kg, and altogether it is huge, heavy. And then I can actually like operate that with my single index finger. So then now that I can do it, I don't need your help to push that wheelchair, which is actually impossible for you. But if you could just ask me, okay, I know you might need some help, so please don't like worry about asking me. I'm here to help you in whatever way you want, and I'll feel so like confident in a group of like people that okay, I can come and ask you when I need some help. So I would be really happy that okay, so I can ask, can you just help me with this? I need help to take that thing to me. So or please give me a pen, or I can't use this. Can you just change this for me? Those kind of things where I really need the help, or I feel so cold, can you switch off that AC? Those kind of things. So everybody, like they know what they want, they know what they can do. So please stop and ask like what they need before you actually make decisions for them. And I have like some blind friends who actually told me what they have experienced. Like they were waiting for their friends to join them, and somebody actually pulled them to cross the road because because people thought they were waiting to cross, waiting for some help to cross the road. These are things like when I share my experience, it is from my own experience, and I'm not making things, though you may feel that you want to laugh when you hear that. So treat them as people, address them by name. I do have a name, and you can like address me, and you can ask me, what do you do what was your first session look like? It was about getting to know each other, telling from what is your name, what are you doing, from where you are, and why did you what did you get interested in? How did you get interested in palliative care? Those kind of things, right? I can also answer those kind of things. You can ask me about that. And then like treat me as an adult. I have got enough like situations wherein people come and like it, if friends do it, you just like see push your like pull your chin and all those cheek and all those kind of things. But then it is and stranger doing that, treating you like a child. Those are the kind of things which like really happen in this world. and then you can speak to me. And then like once I went to a restaurant with my friends and colleagues, and then everybody else like was given a like a menu card, and I wasn't given one. And then when that person came and asked me for the order, and I said, you didn't give me a menu card, from where am I going to choose? Like, he apologized and he gave me one. But then what I'm talking about is like our association with disabilities. That like when you see somebody on the wheelchair, you assume that they cannot read, or they cannot like take decisions for themselves. So that is one assumption. And I was once going for a walk with a friend, and then there was an elderly lady like on their like gate waiting, and then she was like looking at, and then she asked him like, okay, what happened to her? And then, why don't you ask her? And then she was like so taken aback, like, okay, so I can ask her what happened. Then I was like telling her, okay, I stay in that hospital, I work in that hospital. And then that was so much of a shock to her to understand that, okay, I do work also, not just get the treatment. So those are the kind of things which we do without, like, we don't realize that we are doing it. When you come and talk to my mother, okay, what is her name, or where are you going, or whatever it is, like, you don't like realize that there is one more person here, and you have to acknowledge that. That is something which we all happen to do. So that is which we need to be cautious of, so that we don't repeat that. And then, of course, wheelchair or mobility device that you saw in the wheelchair also. See, when I go out, I carry everybody's bags and purses and umbrellas and everything. We enjoy that. It's a friends group. That is not same as somebody coming and leaning onto my wheelchair as a stranger, or somebody coming and holding on to my wheelchair while talking to me. That is so different. We all have this personal space, right? So we need to remember about that, the whole wheelchair, I take a lot of space. I need like not just like you and the way you stand, but when I sit, I take a lot of space, but all these spaces, my personal space. You need to respect that. You need to remember that. As in a friends group, in a non-group, whatever we do for fun, that is different. This is about etiquettes wherein we deal with people with like who are strangers. And then the last one, which I'm going to talk, is like sit down at their eye level if possible. That is also for like if I just if I have to stay like this and talk to you when you stand next to me, it is difficult for me. It actually hurts here when you talk for a long time. But if there are no other ways, we do that. But then if at all possible, I'll be happy that if you sit down, you take a chair and sit down. That also tells me that we are on the same level, and we can have a conversation, one-to-one conversation, person-to-person conversation. We are not standing so tall and high next to me, and I'm sitting so low. So these are like some kind of I'll just stop it here. So I just took some things wherein I can explain with my personal experiences, but for people with blindness, people with deafness and all, there are a lot of resources available on the internet. If you're interested, you can go and check and find out all those kind of things. I'm not going to take this time telling you about 1, 2, 3, 4, 5. I'm sure you must have forgotten what the third one or fourth one was by now. So I'm not going to do that, but it is to get your interest in knowing this kind of things, understanding that, and maybe spreading the word wherever possible for you. So I'm stopping it here. We have 10 minutes. So please, we can discuss anything, share any personal experiences, or ask me questions, or I'm happy with anything. We have 10 minutes. Anyone?
Hello.
Hi, tell me.
Yeah, hi. Hi. No, it is high time. The whole problem is as a society, when people are educated, right from our childhood, we are never been taught how to, deal with anything that is different from us.
Yes,
Okay.
that is so true, ma'am.
Yeah. So in Bangalore, where my children studied, they had the school where they had a class for the differently abled children. Okay.
Mhm.
And the first thing, a pre-nursery child was, the first thing they did was make the child interact with those children.
Mm.
Okay, and for them, it was like, as they grew up, for it was very easy for them to handle anybody with any kind of disability. They just knew how to respect them or how to talk to them or how to deal with them. I think at educational level, somewhere this has to be introduced. Introduced.
It should. And what I see, ma'am, is like problem are we adults. You know
Yes.
what happens when like school kids see me going on the road? They're like they're so interested in how do I operate my electric wheelchair.
Yes.
So they walk beside me. They just like smile at me and walk beside me. And then okay, I also smile, and then they come closer and closer when we move forward. Then I stop there and ask, okay, you want to try? And then they really want to try. And then I say that, okay, this is the power button, this is the horn, and then you have a speed that you cannot increase so much because I tend to fall down if you increase so much. Okay, and then you just try. And then they try on this wheelchair and they feel so happy. And then we struck the conversation and then we ask, okay, so which standard are you? Which school are you? And then they ask me, where are you? What are you doing? They don't mind asking. They are not scared of asking, what are you doing? Adults
Exactly. Yeah.
are like scared because they assume that I don't do anything. And I may be offended if I ask, or I may be worried if you ask me that question because I don't have an answer. But they don't mind that. But then the same age group kids, if they are with their parents, the way like because I have literally seen the parents will pull their arms
Exactly. Yeah.
kids, and then they're not allowed to, and then that tells the kids that okay, this is something to be avoided, or this is something which we don't know how to interact with. But when they're on their own, they come, they have the conversation, they learn about my wheelchair, and then they treat me as like whoever it is. They call me auntie, they call me chechi. All those things are happening. They don't mind or they don't treat me differently. So I think we adult are.
Yeah, I think the mind frame, there should be a change in the mindset. Sorry, there
Yes.
should be but that will come only by experience and interacting. And we
Sure.
hesitate to interact with anybody
Mhm.
who is differently abled. That is our problem.
Yes, that is true.
So,
Okay.
yeah.
We all should get some experience, and kids should also get experience. Okay, I see there's a question. Can palliative care teams? Yes, we do help people to get disability certification so that they get pensions and other benefits. And our social workers do that, help with certifications. Any other questions or comments? Okay, yeah, tell me. How do I pronounce your name?
Shalaka.
Shalaka, okay.
Yeah, hi. This was a very, very useful session, and thank you for doing this. So I come from a cardiovascular pulmonary disability field. I personally also live with one, and I work with hundreds of patients going through these. And so I just wanted to say, that invisible disabilities also exist.
True.
That's a point we did not cover yet. And our biggest issue is that people do not believe us because we may otherwise look absolutely okay. I mean, most days I look absolutely fine, and only I know what hell I'm going through inside me. And so we, sometimes try to do things to make people believe us, and that can mean different things in different contexts. But I also wanted to talk about children with congenital heart defects who are not believed by their parents or not believed by their teachers. These are either diagnosed or undiagnosed CHDs who suffer disabilities at we are not as adults, we are, I go to airports or railway stations, I have to sometimes carry a doctor's certificate. Even that is not believed because I may ask for a wheelchair access. And in fact, sometimes they're so scared that, I'm a person in heart failure or some other kind of serious cardiovascular issues that I might actually die on the flight. But I mean, I wouldn't risk, going on a flight, even buying a ticket if I thought I was going to die on the flight, or if my doctor thought I was going to die on the flight. So sometimes I've actually lied, I've lied to these at these places saying, I have a little ankle injury. So shares. Yeah, so some of these issues, and I also wanted to say that a lot of people. Okay, this may be controversial, but many in our community do believe this, that we do not exist necessarily. Disabled people do not exist to motivate people or inspire people. Do not just see us as that, and it's okay for us to not face.
So true, so true,
We
so
deserve
true.
respect and we deserve accessibility and all of these things, despite we don't have to be anyone special to do that. You are special right now because you've earned your place at Pallium India through all your work and all your awards and everything, but there may be thousands like you who have not had the opportunity to do that, or
So I tend to talk about this because that is what, as I said, I'm not a professional, and only my experience with disability, my experience to talk in this forum. That is why I tend to go through that. But then I have always felt that it is like, for me, it is my disability is so visible. So this is happening. And what you said, Shalaka, about my experience and my opportunities are also very right. When I talk to, especially to doctors and nurses, I tell this very clearly because, like, you see me talking in front of you, smiling and laughing, sharing with you things, but it has taken me many years to be in that position. And when you see somebody who is actually fresh, going through these issues, like for the first time, like they wouldn't look like this. But think of me when you look at them, and then see me when you treat them, so that you know that the possibilities are there, and so that you can encourage, and you not just encourage, but you can actually help them be that. So that is the only request, and I say that to, especially to doctors and nurses, because they are the ones like whom like these people will be seeing for the first time, and then that initial crucial health time is from them. So for them, I always say this, because I know my days are not, even now my days are not always like this. And you know what? We see it in this, like in our rehab centers also. The moment you are in a wheelchair, or when the moment you are sick, you are expected to be so so soft, requesting for things, like so
Yeah.
considerate, and
We
then that
become people pleasers, isn't it?
yes, that is like,
Yeah.
for me it was easy, because I was always like, I was kind of like, as a kid I lost my father, and then my life was also like that. I could only be, I read and I study, and that was only thing. I couldn't my because of those kind of situations where I grew up, those were my general behaviors. But I know, but what happens in usually with people is like, uh, young couples, we see that a lot, when there are like, when your husband is like met with an accident, and then he's going to be on a wheelchair, he's going through this, and then wives, till then they would have had a very rough time going through this, and then bad relationships and fights and all. But then the wife is expected to be taking care of her husband, like loving him, caring for him 24/7, like all the time.
Yeah.
So that is so, like, that is also, I feel so unfair about that, but that is our culture. And then husbands are like, okay, they have their own lives, and if this is the wife going through this kind of injury and disability and all, they are free to leave and go. So these are all like inequities we see in like in the world, in disability sector also. And then like, I'm aware of it, but maybe I'll try to have something included in the about invisible disabilities also in my PPT, so that I remember to mention it
Sure, sure.
when it
Thank you so
comes in.
much.
Because like, I always talk about it, I always acknowledge that, and I tell those people also. I have a TC. I get a TC because it is so visible that, okay, I go in and people know that I can't climb the like steps. So they'll somehow have to make some kind of an arrangement for me. But then when people are really fatigued because of their disability and because of their health conditions, but they can't prove it outside. And mental health,
And
like
mental health, yes. Yeah.
intellectual disabilities, what they go
Yeah.
through and how they are treated. It is all like, there is a lot to change in our
Yeah.
world. I
So
hope.
thank you so much.
Thank you for sharing. It is not very easy to always talk about this. I know you do it, and that is why it comes like that. But it is.
There's also actually this thing that, and this is something I see in the congenital heart defect community, because it's mostly the parents who are active and the children are the ones suffering, but they do not like to be called disabled, even though they can see the children being affected, impaired, affected in every walk of their life, in most walks of their life. They hesitate calling themselves disabled, and this I see even amongst the adult patients. So this is a huge, I know this is a huge area of work as well. The stigma associated with being disabled.
Yes.
But if you don't even want to acknowledge the realities of your existence, then I don't think there's much change that can happen. You can't make that change, nor can you expect that change from others if you don't even acknowledge that the disability exists.
Okay. Thank you so much. So, Sri Priya,
Yes, Ashla
just
ji, I was
4
listening.
minutes
Yeah.
extra.
Any other quick burning questions or any other last minute words to be shared? Otherwise, I think we can call it a day.
Okay, so there is one like question by Indira ma'am, I see families tend to treat physically disabled people as infants, even when they are adults. It is actually a very difficult situation wherein, because see, I am actually my mom gives me a bath and dress me up. So it is quite natural for her to treat me as a child. It takes a lot of effort from the caregiver's end and from the person's end to come out of that, and it is not very easy. And more what is more difficult is children with congenital disabilities, because when they become adolescent and adults, parents and others around are not able to even accept that kind of things,
Mm.
how they
No,
go through their adolescence, and then what about their sexuality and their issues, and treat them as adults. They can make decisions, and how do they do it? There's so much to change, so much to
right.
learn.
Now, I was thinking of my cousin with a hearing impairment, and he was never included within family. I mean, by treating as a child as if his opinion didn't matter. When we were chatting, we tried to include him, but they said, no, it's okay. So why was it okay?
Mm.
Because he likes to be included, no? So when I meant, I had him in mind when I was asking that they tended to treat him as if someone without any opinions, without any,
One of my deaf friends, he was saying, people will come visit home, they'll spend 2 hours and they'll have chit chat, everything. And then after, when they leave, I'll ask my sister, okay, what did they say? Oh, we were just chatting. So
Mm.
from those 2 hours which they spent, this is what I get. And this is the amount of information I get from the world also. And then how do you expect my knowledge to be the best? And then how can I be informed of all these kind of things? Those are big questions.
Absolutely. Thank you.
Mm.
Thank you for this session.
Thank you. Thank you for being there and listening.
Thank you,
What is
Ashla Chechi, for joining us. I know that it has been raining profusely in Trivandrum, and all of us, including me and you, are shivering with cold, and still you found out time. Personally, I would say I have always seen her only smiling like this, and that is what motivates me a lot. Morning when I report to work, I see her, and just we smile to each other, and that makes our day, I suppose. So thank you for being there for us, Ashla Chechi, and thank you every participant for listening to her today and sharing your own experiences, because I believe that is what makes the world a better place for everyone. So with the hope that things will change for better in coming days, and also gently reminding that tomorrow, out of the schedule, we have a session planned, and we'll be meeting tomorrow, same time, with another eminent speaker. This is Sri Priya, along with Miss Ashla Rani, signing off from the Tips Echo Up. See you tomorrow, everyone. Till then, take care. Keep spreading happiness. Bye-bye.